Hi, I'm Dr. Kevin Knox. I'm a board-certified hand surgeon, and this is Mandy Chalet, and we're here to give you a tour of the Orthopedic Surgery Center of the Fox Valley. It's a brand new state-of-the-art facility that we're very proud of, so we're happy that you're joining us to let us show you what we have.
Here we are in the reception area where you will check in. Prior to this, you will get a phone call from one of our prepared nurses, and you will get your instructions, your pre-op appointments, and such. And the day of surgery, you'll come here to meet our cheery receptionist, and she will get you all checked in and ready to start your surgical journey.
Okay. We'll head over to the pre-op area. Just as a point of fact and our safety precautions, we do not treat COVID patients here. Any patient who comes here for a procedure will have had prior COVID testing. The staff is vaccinated and tested as well. We're still wearing masks because of the CDC recommendations as a safety precaution as well.
Here in the pre-op area, you will meet your pre-op nurse. She will take you to your pre-op room. She will get you ready for surgery. She'll start your IV, ask you some questions about your history, medications, and get your surgical site prepped. That journey starts in one of our pre-op rooms here. Once you are all set and ready for surgery, the anesthesiologist will come in and greet you and talk about that journey as well. The surgeon will come in and make sure that you have all your questions answered and are ready for surgery.
Okay. Your next stop would be the operating room, and while we walk over there, I'll just go over kind of our vision for what we want to accomplish here. We want to, of course, provide effective care in the safest way and get the best optimal outcome, but we try to do so with keeping in mind the cost of medicine to patients, and we try to do it in the most cost-effective way, of course, without sacrificing safety or outcome in doing so. So here's where you'll enter the OR. We have 4 operating rooms fully built out now. We have the capacity to build 2 more out in the future, which we intend to do once we're up and running a little bit more. So here's an example of one of our ORs. They're basically all the same. Brand new, everything brand new, state of the art. We can perform basically any type of orthopedic procedure here. We have foot and ankle specialists, we have sports medicine specialists, joint replacement specialists, revision joint replacement specialists. Myself, I do hand and wrist surgery. We cover basically the entire gamut of orthopedic surgery with the exception of spine surgery. We're pretty much capable of doing almost any procedure here, and our safety rates at a surgery center are better than hospital rates, and our cost is approximately 30 to 40% lower as well. So, we'll move on from here when your surgery is over to recovery, which is just around the corner. So for any potential patients, you probably won't remember any of this part because you'll still be a bit sedated. This is the recovery area. Patients will leave the OR and come here. Like I said, most of the patients will still be pretty sleepy at this point, and they'll wake up here, and the nurses will be checking on them, making sure they wake up appropriately, that their pain is well controlled. Depending on what type of surgery you had, your next stop may be back to your pre-op room to gather your things and be discharged, or if you're having a joint replacement and plan for an overnight stay, you'll be heading this way to the overnight stay rooms, which I'll show you now.
Here, if your total joint and going to spend the night with us, your recovery journey will start here. You'll have a nurse and a CNA through the night dedicated to all your needs. Via if you're hungry or you have pain issues, they'll more than experienced to get you through the night, and you'll be resting comfortably. In the morning, they will get you up, get you dressed, get you something to eat, and you'll have a visit from physical therapy. You'll get all your post-op instructions, your follow-up appointments, and you will go home and start your recovery journey in the comfort of your home with your family.
So I also wanted to mention, I won't take the time to have us walk all the way down there, but in our clinic there's also a procedure room where we can do quite a number of hand-based procedures, but also foot and ankle and some other orthopedic type procedures that can be done under local anesthesia. And the advantage to the patient when that's possible to do it that way is they can eat breakfast before surgery, they could drive themselves home, but possibly the most significant benefit is that because it's moved out of the OR into a procedure room, the cost of the facility fee is eliminated, which makes it far, far cheaper. So we have been trying to shift cases that are appropriate out of the OR into the procedure room, again, because we're trying our best to be cost conscious to the patient. We understand that. In general, the surgery center is our desire that it's a very calm place, that it's there's enough anxiety for the patient having surgery already. We want to mitigate that as much as possible. Culture and atmosphere is a big deal around here, more so than any place I've ever operated, and the staff take that seriously. And it's a very calm place. People are very helpful, happy to answer questions, whether it be the patient's questions or the family's questions. And we want to make sure your expectations are exceeded. And we hope you give us a chance here at the Orthopedic Surgery Center in the Fox Valley.
We do have a question about if OSMS does robotic surgery.
We don't do robotic surgery again because that's an extra expense that gets passed on to the patient, and we don't believe there's a justified advantage in robotic surgery as opposed to traditional surgery to justify that cost.
Another question, is this OSMS's only surgery center?
We also have a surgery center in Green Bay. We have clinics in Green Bay, Marinette, and here downstairs as well. Well, thank you again for joining us. We're really proud of this place. Happy to show it off. Hopefully you can come see it in person.
Thank you.